Hello, it's Sarah, your community educator. One of the most common questions that I get when I'm out and about is, aren't hospice and palliative care the same? The answer is no, they are actually two separate programs. Hospice of Northwest Ohio has a palliative care program called Sincera. It is for people who are not on hospice, but who have been diagnosed with a serious illness. The program was started back in 2008 at the request of some of our local physicians who recognized our team's expertise in pain and symptom management. One more question. What would you say if someone asked you what palliative care was? Okay, what if I said palliative care is not hospice, but hospice is palliative care at the end of life? Does that clear it up? Put simply, palliative care is a medical subspecialty that follows a philosophy of wholeness and wellness. That's right, I said wellness. A patient who takes advantage of a quality palliative care program like Sincera is someone who is doing everything they can to focus on being cured and feeling well again. Palliative care follows the philosophy that when someone is dealing with a serious illness, it affects them and their loved ones, their inner circle, in more than just physical ways, because there's more than just physical pain. It's also the emotional toll it takes, and the spiritual questions that may arise, and the practical side, things like paperwork and insurance. Palliative care helps the patient and loved ones navigate this complicated world of healthcare when they are thrown into it. There's time built in to have the tough but important conversations related to things like goals of care and advanced care planning. Sincera focuses on trying to provide relief from the symptoms and the stress of being diagnosed with a serious illness. Our interdisciplinary team does that by collaborating with the patient's current physicians, having experts who are certified in palliative care, who are familiar with local community resources. They provide professional counseling and support for the patient and loved ones. And a lot of people don't know, it is covered by Medicare, Medicaid, and most commercial insurance plans. So the biggest difference between palliative care and hospice is that people on a palliative care program are still pursuing curative therapies. It is used at the same time as full-blown treatment. If hospice is then elected, the focus turns from curative treatment to comfort. If you have any questions, feel free to reach out. Thanks for watching.